members of YOHAN. So please pay attention because she's not going to be sharing her screen. So please pay attention to what she has to say.
On January 31st. And
okay, hello everyone, please
money.
Thank you.
First,
okay, I guess.
Can you transfer the hosting to me, please?
All volunteers are network members, but then not all network members may be volunteer. Just as he has said before, let me shed more light to that. Okay, as we have all applied to join YOHAN to be a member, we are network members by registering, but we will only become a volunteer when we participate in projects done by the different sections of the organization. So for now, we are going to be called members of YOHAN Africa. So we have our visions and our mission, and our vision is to be a leading non-governmental organization that fosters health for human development in Africa. And our mission is to effectively engage the African youth in promoting health in communities. So we have our core values. We have 5 core values, which are integrity, collaboration,
Have you heard of YOHAN Africa? We just they are doing onboarding for us. Yeah? It's not a real job, it's a volunteering like
hello Philip, can you please mute
Can
yourself?
you mute?
they're not paying you, you're not it's just like humanity this thing. Like YOHAN Africa.
Hello, Mr. Philip. Please, can you mute yourself?
Are you talking again?
Hello. I think the host can limit the participant ability to unmute themselves.
Yes, we are going to do that now. We are having a little bit of technical issues, but that will be sorted out in a few minutes. There it is.
This model 2 and not be choice. The model 2
Mr. Philip, is there a problem? Can you mute yourself, for goodness sake? It's getting irritating. Philip,
course like this need to be smooth. As you're doing it, you're just passing, just having background knowledge. It's not like
I think is there a way we can remove him from the or something?
I'm sorry. We are having someone. The posting was transferred to someone who is Adela Jafatima. I don't know why we join a meeting and we're not paying attention. I've sent messages. I've called out. and the person is not responding. Who is Adelaja Fatima? All right, we're going to sort this out as soon as possible. I'm sorry for the time we've lost. Because I mean, it's obvious that people cannot just decide to mute themselves when they join a meeting. I don't know why, which is like the first thing I do when I join a meeting. Please, let's learn to do that. When you join a meeting, ensure your video and audio is off, because I mean, that's like courtesy, all right? Please, for future reference. And, you know, it's not nice that we are being so distracted.
Okay. Thank you very much. So, just as I was saying before, we have different focused program. We have the advocacy for elder liver and sexual health. We have the Save a Breast campaign, the Safe Space Nigeria, and the Sinex program. So those are our focused programs at YOHAN Africa, and we have a range of other things we do, like our summits. We hold a bi-yearly summit at YOHAN Africa. We have the YOHAN Research Institute. We have webinars, trainings. We hold book reviews and all the similar programs at YOHAN Africa. Can you please mute yourself? Faith, yeah. Faith, can you hear me? Okay, thank you. Okay, yeah. So I think we can hear me now. So as members as network members, we are expected to join a team. We have different teams at YOHAN. We have the project management team, we have the grants team, we have the media and brand management team, we have the monitoring and evaluation team. So, as members, we are expected to join a team, and we don't just join a team. We have the opportunity to learn new skills and
Sorry
on
to
our
sorry to
existing.
disrupt. You can share your screen.
Okay, all right.
Sorry, we are so sorry, guys, for the distraction. So we're able to mute people now, but it's not nice that we have to be going back and forth to it. Okay, just mute yourself when you join. She'll be able to share her screen. So we can as fast as possible.
So I'm sure we can all see my screen now. So just as I've said, we have all members are expected to join a team where they can learn new skills and also develop their existing skills. So we have the project management team, we have the grants team, the media and brand management team, and the monitoring and evaluation team. Yeah, okay. So I'm going to go right into the code of conduct, our rights and responsibility as members of YOHAN. So this, okay, can we please avoid touching our screen? Thank you very much. So in YOHAN we believe that members needs to be committed in order to provide a very supportive environment. So we believe in effective and meaningful volunteer involvement. Please let us avoid touching our screen. Thank you very much. So this code of conduct applies to everyone at all levels in the organization. And firstly, we need to be responsible corporate citizens by complying to the laws and regulation of our country. We cannot say we are volunteers and we are promoting sustainable development without abiding by the laws that guides our community. Yeah. So change begins from a person, and we need to do our part to foster an environment of inclusion and belonging. So, and we can do that by active listening. We should listen to other people's point of view and fostering an environment of inclusion. So, and also as members, we need to communicate respectfully and honestly at all times when when we're communicating about a particular project, or we are trying to, advocate for particular um a particular program. We need to learn the act of communication by communicating respectfully and honestly at all times. And as members, we should ensure either on our network group or during a particular program, we should ensure we are not disrespectful in any form. We are not threatening, we are not intimidating, and we should avoid harassing any network member or any collaboration. Respect is it's a key, yeah. And also, as we are from different cultures, we are from different environments, discrimination is not allowed. As members, do not discriminate on any ground. And also, like I said, the fact that we are network members does not mean we are volunteers. To be a volunteer, we need to participate in our programs. So when we are participating in programs, we should ensure we fulfill tasks. Yeah, and also within a particular time frame. Time commitment is also key as network members. We should also take full responsibility for any task or project. Okay. A minute, please. I'm going to reshare my screen now. Okay. All right. So we should take full responsibility for any task assigned to us. Sharing of private or personal data to whether people outside of YOHAN, other network members should only be done with permission. So, if asked to share any personal information, please first authenticate the request by reaching out to the board of directors. And also, we need to keep accurate record of project activities. As volunteers, we are going to it is a duty for every volunteer to carry out a particular project yearly. So after carrying out the project, we should ensure we keep accurate record of the project activities. How we're going to carry out the project will definitely be explained to us by the project team after this. And also, if you're responsible for generating any report, please ensure it is clear and concise, following a particular template that will be shared with us. And we should ensure that it is submitted within the required time frame. And also, we should obtain any necessary permission before using any intellectual property. When I talk about intellectual property, like maybe any research carried out, any reports generated during a particular project, before sharing, we should ensure we get necessary permission. Also, we should avoid corruption in any form during the course of our project. Honesty and transparency is key. And also, as we are network members, definitely we need to network amongst ourselves. And while networking, we should ensure we build ethical relationships with ourselves and also with any third party. It is our due diligence to investigate the authenticity and trustworthiness. And also, we respect political and religious beliefs of choice of any network members. So please, we should keep politics or religion out of our dealings as network members. We side with no political party and no religious stand. All we care about is sustainable development amongst ourselves. So we should not speak on behalf of YOHAN Africa without any permission from any members of the board of directors. And also, we should not side with any party on behalf of YOHAN Africa. Do not use YOHAN's Africa name irresponsibly, either online or offline. We should not share any internal materials, including emails, with the media. And if we are to share anything, we should ensure we take permissions. Should ensure we take permissions. So do not enter into any agreement on behalf of YOHAN Africa. Any of such request, probably any of such requests, probably there's a request for partnership. It should be directed. It should be redirected to the executive director or the right channel, the right member of the board of directors. So if any member is seen to breach any of this, he or she can be terminated as a volunteer. So YOHAN Africa has the right to terminate such volunteers' position if there's any case of misconduct. Yeah. So that will be all for the code of conduct, and this will be shared with us as network member after this meeting. So thank you very much for going along with me and listening attentively. And I'm sure we all understand all that has been said so far. Thank you very much. Yeah. Okay, so without much ado, I'm going to Dr. Gamba is going to speak with us next on how to navigate the website and some other things. Yeah, thank you.
All right. Thank you very much, Tolu. Thank you. Um, we have just an hour. We would like to, cultivate the culture of keeping to our words. We said we will keep to time, and that's what we will do. All right. So, Tolu, please make me please mute yourself if you're not talking. Mute yourself so that we can have less distraction. All right, so I'm going to share my screen, and what I want to do is what I want to achieve is basically to just tell us about what we can achieve on the YOHAN website. I don't know how many of us have gone through the website, and okay, so I'm trying to share my screen. Please remember that you can ask questions at the end of the meeting. All right, just make sure that you take note of your important questions. All right. All right, can you guys see my screen? Can you see my screen?
Yes.
Yes.
So I'm going to be talking to us about the features on the website and how we can get to navigate through the website effectively. The first, Tolu has done some justice to mission and vision of YOHAN Africa, but there's a lot more to learn from the website. We tried to make it like kind of a hub. It has every information that you need as a network member to succeed in your journey with us, in your quest to make a difference. All right. I want to say at this point that those of us joining on YouTube, please, we're going to, when it's time for questions, just you drop your questions in the comments and we're going to answer them together. All right. So because we have a number of network members joining on YouTube, and the link to the attendance will also be shared on the YouTube page. All right. So this is the website. It has everything you need. Like I said, if you want to if you want to know about YOHAN, so there's a page telling you about us. There's a Teams page in case you want to know the team members we have, people they're going to be working with. There's a board of directors. I'm going to come back to this, which is verify a member. I'm going to come back to it later. And this is the programs page. So this has basically all the programs that we have currently YOHAN. All right. So we can see that we have all the population health intervention programs, which are currently 4. And then we have the CEC program. So, okay, I'm going to explain. So the population health intervention programs are programs that are, are basically low-cost intervention programs that are aimed at, improving health outcomes, of populations, different populations in the African continent. For example, the Save a Breast campaign addresses issues around breast cancer, knowledge of breast cancer, self-examination, ensuring that young girls are taught self-examination at a very young age. And the website has every information you need. It talks about this page talks about the program, and if you click on the resources section of each of the pages, you're going to see more like a document that has been put together to help you understand the subject matter that each program is trying to address. And I want to, at this point, start ensure that we also understand some terminologies. Okay, there's a difference between program and project. Right, a program is more of a long-term endeavor that we are engaging in to solve particular issues that affect specific demographic. All right, while a project actually is dealing with just a shorter term endeavor towards achieving the broader program objectives. So when we're saying project, the project is mostly just a short term stuff, while the programs are longer term stuff. So that's like an oversimplified summary. All right. So this is like the resources page for the Save a Breast campaign. So you can easily download this document in case you're doing something that is related to breast cancer and you want to be able to get a resource to do that with. All right. And we also have that for the different programs. So I'm not going to go through all the pages because that's going to be time consuming. But in your spare time, go through all the programs we have. We have advocacy for healthy living and sexual health, and it deals with sexual health issues, mostly focusing on hepatitis and HIV, especially young people. And there's also a focus on ensuring that we have more coverage for the hepatitis B vaccine. All right, so we've been able to vaccinate quite a number of people. We've completed a number of projects under this program, and I think about 17 projects under this program. So it's actually one of our biggest programs, and we have some newer programs. The Safe Space Nigeria program focuses on mental health and advertising mental health information, and linkage to care, especially to young people. Right. Our focus when it comes to population health intervention programs are not only young people, but most of the times our beneficiaries are young people. Then we have the SINEX project. SINEX is actually focused on the issues of non-communicable diseases, hypertension, and diabetes, which is actually our this is like the youngest project, the latest of them. All right. Then we have the CEC programs, very important. CEC means to connect, to engage, to empower, and to commission. All right. And this is self-explanatory. All right. This is actually the project that is aimed at helping you become a better health activist, helping you to make your contribution to health systems, to the health of your community. All right. So we have biannual summits, which we had a number of summits. You can do well to go review summits that we've done so far. For them, we actually have one. We are planning to host another summit. You're going to get the information soon on when that is going to be. We have our global health changemakers dialogue. We have our fellowship programs. Then in our resources, we have our blog, we have our podcast, we have our training. So under the training, we've done a number of training, including medical writing training, we've done grant writing training, we've done project management and public health training. So there's a lot that we've done that you can benefit from as a new member. I know some of us in this meeting are already members today with us for a long time, but now we are making everything official. In a few minutes, programs team will talk to you about one of the major criteria of being a member of the or being recognized as a member. We also have a research institute because one of our strategies is research. All right, we have a full-blown research institute which is actually semi-autonomous. All right, when you have time, like I said, go through every section of the website so you can be updated on what we're doing. All right, so I want to go back to the home page before I come back to how to log in. That will be the last part of my presentation. You can see that we have 5 major strategies, which is networking. Our 5 major strategies is networking, health education, advocacy, and low-cost innovative interventions. Okay. So these are like our approach to solving the myriad of health issues that face Africa today. You've been told what our mission and our vision is. We actually believe that there will be no health without, there will be no development without health, all right, and vice versa. And we believe that you as a young person have a very crucial role to play. Africa today has 70% of our population as young people. So we want to engage these young people, including you, to be able to make what we do and also to learn, because we also share very for example, you can start with the African youth, how to create sustainable impact in the health sector, which is actually from the lessons learned in our first summit back in 2022. You can go through and understand in that. All right, and the next will be, I don't know why people don't meet themselves and enjoy meetings like this. It's actually strange to me. It's okay. Let's move ahead. So these are our partners. I want to use this opportunity to say that we are very, very strong on collaboration. All right, because you can't achieve much without collaboration. Right. So when the programs team will talk to us about our projects, which is literally for everybody to do. Don't worry, don't be scared. It's not going to be, we are here to guide you every step of the way, but that's a major criteria for membership. So when they're going to talk to you about that, I know they're going to also emphasize on collaboration, because I'll give you an example. Some of our, a number of the projects we've done successfully, some of them were done with 10% of the proposed budget coming from us as an organization. Why? Because we got other organizations to share in the idea, the vision to push for that particular project to be done, and eventually got it done without spending so much, breaking the bank. So I'm going to end with this, which is how we've all signed up, so that's why it's done. So this sign up is for new members, and for now we've put a halt on membership, so we can at least manage this batch maybe by beginning of the second quarter of But so it's important that you know how to. So yes, this is the page to log in. What you just do for now, there isn't much there, but so each and every one of us got an email. Sorry, that's to call to get back and update our profile. If you've not done that, this is how you can do it. You know, use the email and the password you chose when you registered to submit, and it opens up your portal. Okay. Now, what you do on the portal is basically to just edit your profile, which is, you know, if you want to edit your profile, you know, update your profile picture if you've not done that. All right. Just click on choose file, take it to your gallery, choose a picture and you upload. Please choose a picture that is decent enough. And if you want to adjust anything like your current location, you can do that. Linking profile. Then this project link is very important because that is actually one of the reasons I want to show us this. So when we eventually do our projects, we submit the reports, we're going to be told how to go about it when it's time. But it's important you know it now because, I mean, I know a lot of us here are very ambitious. So people might want to start to do a project next month. So yeah, so it's important we know everything that apply. So when you're done with the project and you submit your report, you're going to get a link. And this link is what you're going to upload here. Okay, so the program team will send you back the link and you upload the link and you save. All right, so it means that when I come to your profile, I'll be able to click and then see what you've been able to do, what you've accomplished. Right, so it's actually one way of showcasing what you've done as a member of YOHAN Africa. So this is my bio, very, very, very short. I can edit my bio, all right? In case you want to edit your bio, I know some of us rushed the registration. You want to like edit your bio, you can do that here. Just click on save and everything reflects. So so if it appears like this on desktop, let's change some things here. So it shows your the date you joined us. When if someone wants to connect with you on LinkedIn, you can do that here. Then if I click here, I should be able to see your project. That's the project link. All right. Very importantly, because we also need this for this meeting, this is your ID. So a number of us might need to log in if you're not taking that. Instead of typing it out and making a mistake, you can just copy. All right. Just click highlight, copy. All right. So that when you want to fill a form, you can just because in every form that we're going to be filling, you're going to fill in your ID, all right, including the submission of the proposals, okay? Because it is your ID that we use to track you. There are quite a number of members already. We have about 400 plus members. So this is how we track your progress, your movement, and a number of other criteria that we have, which will still be communicated today. So now, let's say that I want to see what view a member profile. Actually, we need their ID. So let me choose this person. Let's see. So if I highlight the ID under who we are, you'll see verify member. So under the verify member, this page will open up and you click on verify member and this is me. So if anyone, let's say you're applying for a project and they ask you for a personal website or a project or whatever, some people ask for it, you can actually use this, all right, as a member. But please note that if for any reason that there's a breach in the code of conduct or you have failed to meet up with what has been outlined as the requirements for retaining membership, we can if on our end we deactivate your membership for a while, when anyone clicks on verify member, this will not pop up. All right, so it's important to also take note of that. So this is how anybody can access your project link and access you as a person to know if you're a member of YOHAN, you joined us also time. And another important thing is that when for any reason that you were deactivated and there is maybe an appeal for you to be reinstalled as a member, whenever that happens, whenever that is approved, that is when membership dates of joining membership, that's actually when it starts reflecting again. Right. So an example, if you join in January and for any reason you deactivated in April, reinstalled in June, your membership will start to show that you joined in June, all right, and not January. Okay, I hope that's understood. So there are a number of other adjustments that will come to this. For example, we are working on developing some courses, that will help you in a lot of ways. So this is one way you can access those courses, through your profile also. But that is an improvement that we're going to communicate when it happens, and we're working on that and tell you when everything is ready. So there will be a lot of improvement on this, but this is like what it is for now. So just know how to get right. And then under careers, just in case we call for, we need you to apply for any positions. Just recently, we had 2 more program managers join us, program manager for SciNext project and Safe Space Nigeria. We're very about that. And so this is how you apply. Let's say there's a project that needs a project manager specifically under a program, which is not your own individual project as a member, and you want to apply for that. This is actually where you do that. So basically, this website, like I said, there's a lot more sections on this website, but this is like where this is actually, there's a lot of things you can do on the website. You want to get our donation link to share for anything, it's here. Everything you need is here. Finally, these are our core values, which includes excellence, inclusiveness, sustainability, integrity, and collaboration. Please take your time and go through every single detail. Okay, it's important because we want you to be able to, when you represent, as a member, you're like an ambassador, right? So when you're representing us out there, we want you to be able to fully understand what we do, how we do it, why we do it, every single thing we do, so that it's not like, someone is asking you questions about YOHAN Africa and confused. But you're a member. Claiming to be a member, it wouldn't make sense. So, and a bit of a correction, I want to start saying it now, it's either Youth Health Action Network in full or YOHAN Africa, all right? So I'm going to stop here and I'm going to allow the program manager the director of programs rather, Praise, to go ahead and tell us about I think that's the crux of the matter today, which is very important that you pay attention to the next session. I promised us that this meeting is 1 hour, 30 minutes. And like I said before, there will be an attendance shared at the end. So please, it's important that you stay to the end because we'll start counting your commitment from today. Okay, so Dr. Praise, I'm going to make you an admin now so you can share your screen. Please, like I said before, keep your questions. We're going to answer all your questions in due time. We'll try and spare 15 minutes to answer all your questions. Dr. Praise, I'm looking for you. So just give me a second. So while we have some time, you can just be thinking about your questions and you can be thinking about your questions, and if you have any specific contributions to make, you can have time for that today. So I'm very happy to have anchored this session, and I hope we all understood what was discussed, right? All right, Dr. Praise, you are now the host. Please go ahead and start your presentation.
Okay, thank you very much. Good evening, everyone. I find it a privilege and an honor to be here. Can you all hear me?
You're very audible.
Okay, thank you so much. My name is Praise Onuoha. I am a medical doctor, among so many other things. Yeah, so YOHAN, I'm the director of programs, and we're going to be having, let's call it a practical session. So you know the next steps. All right, so I'm going to share my screen. But before we get into that, let's take 2 minutes. I want to know where most of us are joining from. Where are we joining from? Are we joining from Mars, Jupiter, Iceland, you know, I don't know, Ogun State? Wow, dude, are you in Ogun State? Oh, Lagos, Kaduna. Kaduna, you're close to me. Japan, Ghana, Tanzania. Hi, Juliet. Kosi is in Abuja. Enugu from Kenya. Oyo, Spain. Spain, my goodness. Ondo State. That's beautiful. Cameroon. Eswatini. I'm sorry, I do not know where that place is. Forgive me. I am happy to have you. Plateau State, Bangladesh, Morocco, Pakistan. Akif, good evening. Or I don't know what time it is at your end anyway. Okay, thank you so much for that feedback. I'm going to share my screen now. This is 5:54 p.m. at okay, let me just share everything. All right. So we should take about 15 minutes. Dr. Gambi, I hope I'm correct.
Yeah, 15 to 20 minutes, so we can have at least another 15 minutes.
All right. Are we still going to have the grant?
Sorry, yes. So please stick to 15 minutes.
It's all right. That's fine. So half of the things in this slide have been shared already. So I'll just go to the meat of it. Now that you're part of YOHAN, all right? Now that you have come in, I know some of us here are old members, but I think it's also a good thing that you're here with us so that you can also be realigned, all right, to the vision and the mission. And in case you joined many years ago, a century ago, and you've not been very active or you've not really known what to do, this is a very good opportunity for you to to catch up. And for people who are like fresh, you're welcome. All right. So alignment to our vision and mission is so important. And the assistant human resource manager had already, spoken about this. The mission is to effectively engage the African youth in innovatively promoting holistic health in communities. You are a very important element, factor. You're a very important person in the African continent as long as 2024 is concerned, 2025, 2040, I don't know. But from this moment on, as we speak now, upwards, the youth are a very, very, very important part. All right. And you see, if you don't see yourself as an important element in the system, you have this complacency. People like government, or my CMD, or my university, or my school, or my workplace. But when you understand that you as an individual coming together with other individuals with like minds can be a force, it is very, very crucial. All right. Before you even go into projects, executing projects, you know, typing all those big grammar on LinkedIn. I collaborated with the World Health Organization XYZ. Before you even get there, there's something that has to happen to your mind. You have to have a mission. You have to have something that you're looking forward to. All right. And where we start from is understanding that you are a very important element in this. All right. So our vision talks about fostering health for human development. And the CEO mentioned something about you know, health and well-being is very important to development. People who are ill, people who are sick, or they're not strong enough, they're battling whatever it is they're battling, let's say cancer or so, they they are not like very much able to be actively in the forefront. Do you understand? Of encouraging health, health promotion, health advocacy, and all of that. So we are saying that it is very important to have a healthy nation to have development. And that's also something you have to have at the back of your mind as you're looking at project management, executing projects across Africa, across the globe. So now we've talked about the mission and the vision of the organization. You also have to sit yourself that what is my own personal goal? People are joining organizations now because it's the quote unquote right thing to do, or it adds to the CV, which I do not disagree with. Okay, it opens us for opportunities, which I do not disagree with. But you see, it's not good to be aimless. So there's a vision for the organization. Please, can you mute yourself, please? Please.
Please just mute them. Don't need to ask. It doesn't.
All right. All right. Okay. I'll have to. Okay, so let's go on. So you would have to align your own personal vision to that of the organization. I'm not a fan of aimless, project execution. So you after this our interaction this evening, sit down with yourself. Really, in this health space, in this community, in this area I'm interested in, what's my vision? What's my vision for girls, for teenage girls? What's my vision for sexual reproductive health? What's my vision for have a personal vision, and then you see how you link it to that of the organization. The strategies that we use have already been talked about: research, health education, advocacy, low cost interventions. These are all going to be factored in one way or the other in every project that is executed across the organization. And our programs too have been highlighted. So this is a very important slide. In monitoring and evaluation for organizations, we have something called theory of change. How do we create impact? How does change occur? Is it just somebody that just sat in their house, had an idea, and boom, change happened? Not necessarily. All right. We have outputs. You have to have an outcome that you're looking at. We have to have outputs, things that if I do X, Y will be the result. Okay. And then we have activities. What are we going to do? So the on the left hand side, okay, or maybe I should start from the right. The ultimate goal is improved health of African communities, but then there is a way we have to get there. And so these green boxes that you see in the middle, if we put all of this together, it will lead to improved health of African communities. So now when you have a project you want to execute, or you're even thinking what project can I execute, you can look at this slide, at this image. It's just one shot and it gives you an idea. Where are the areas to look into? So we're looking at improving the health of African communities. How do we get there? Increased awareness of sexual reproductive health, breast cancer, mental health issues. Increase youth contribution. You see that you come in again to evidence-based solutions and sustainable development. Improved access to testing and vaccination. And then the last box there talks about effective execution and amplification of youth-led innovative and sustainable health solutions. So Juliet in Tanzania does project XYZ. Oh my God, it had massive results. But do you know that if it is only in Tanzania that happens, the impact, well, of the community is felt, but it is also important that it is amplified. Somebody in Uganda can look at that project and say, wow, okay, I'll just modify this, modify that, and I can also implement this in my own community. And that is the importance of YOHAN as a network. So you can actively see other people like you, your peers, carrying out projects. You can learn from them. You can collaborate with them, all right, to lead to the improved health of African communities. So this is how we bring about change. And then on the other side of the image, we now have particular activities that we do, carrying out offline and online health promotion campaigns. So just looking at this, you can have an idea of what kind of project I can execute. You just need to do one project the entire year. All right. So just looking at this can give an idea. Carry out offline and online health promotion campaigns for any of the programs. All right. Empowerment of youths with health research skills, subsidization of human papillomavirus, hepatitis B vaccine. So these are specific activities, actions that we carry out. So you have a project in mind. You have a project in mind. What do you do next? So the first thing to do is to look through the project proposal template. Just give me a moment. I'm not going to be very elaborate, but if you can all see my screen, this is the template. All right. It has all the headings. So we have the executive summary. It gives you a brief description, right? The background of the project you want to execute. Why is it important in this community? Why is hepatitis B a problem? Is hepatitis B even a problem, right? I mean, it could be something else, right? Why is there low awareness of cervical cancer? So what are the risk factors within this your target audience that qualifies them, to be the people that will receive this solution that you have in mind? All right. So the objectives, what do you want to achieve with your project? What is the impact? And you see, impact is measurable. It is measurable. 60% increase. That's just a random example. So in this template, you have random examples that you can, that just helps your mind work through what is being talked about. So you're going to use this template to think through. In fact, I advise you, especially if you have not executed a project before, all right? You can have an idea in your mind. Look through this template. The link is going to be shared. Look through the template to help your mind work. You know, what are the things I need to put together? Who do I need to call? How do I get collaboration? How do I get partnership? Right? How do I mean, just look at this, assumptions and risk, for example. What's something that can hinder the project? Imagine you didn't even think about it, right? Imagine you didn't think about the financial plan, or you didn't think about the possibility that students will be having exams. Imagine if you didn't think about it, then it will frustrate, the project that you're trying to execute. So really, this template will help you think through the entire project. It will help you plan, all right? It will give you an idea on where to look at, who to reach out to. Okay, so in your own spare time, you can look through the template. So that's the first step, really. That's the first step. If you have a project you want to execute, just give me a moment, please. Okay. So first thing here is to peruse the project proposal template. Then the next thing is to think on paper, right? Who is going to help me achieve this? And there's something I want us to cancel from my mind, that I can do it by myself. And see, uncle, sit down. Impact collaboration helps impact. In fact, it amplifies it. You can achieve way more when you collaborate with others. And when I mean collaborating with others, for example, we had a project where we had to collaborate with the head girls of the senior secondary school, and just imagine that you're like, you hold me, these students, I'm supposed to give them instructions. See, they are in that community. They have people that listen to them. Those head girls, they are what stakeholders, whether you like it or not. You don't have authority in that setting. So it is your best interest to collaborate, for example. All right. Now, when you're also thinking about the project, when you're also planning, you also think about resources. How many people do you need to reach out to 500 people, to 300 people, to 50 people, right? You need a certain number of partners, volunteers to effectively reach out to these people within a given period of time. What financial partners Okay. Do we have, I mean, do we need permissions from, for example, the vice chancellor of the university? These are the things you have to look into. All right. Now, if you have never executed a project before, we have a, will I call it a series? Dr. Gambi doesn't qualify as a series. But we have some
Yes,
videos about
yes,
basic
yes.
project management
First,
in public health.
can you please make your screen, make it full screen so that we can see?
Oh, okay. All right. Yeah. So we have a mini series about basic project management in public health. We break down the phases of project management. All right. Um, and we also looked at a sample project that has been done within YOHAN. And one of our previous state coordinator, which is now a country director, Ekachi Nelson, led us through how he actively executed the project. So that will be very helpful for you if you're new to this. You can look out for that either on the YouTube channel or on the website, as Dr. Ogaba has already showed you. So another thing is, if you're looking at carrying out a project, for example, related to hepatitis, you shouldn't do that in a silo, all right? Since you're doing this under the Youth Health Action Network Africa, you have to reach out to the programs manager for advocacy for healthy liver and sexual health. And currently, the person filling that position is Dr. Omar. All right. I would encourage the human resource personnel we have on the call to please put together the names, titles, and possibly contacts, like WhatsApp contact of all our leaders, so that people are not confused on who to reach out to and all of that. But I appreciate that.
Uh,
So if you have a project, for example, related to breast cancer, you reach out to Dr. Chidera. She can put you through. They have been doing projects in this particular field. So there are things that may not even cross your mind. But because you have interacted with them, they can now put you through. Do you understand? So speak with your programs manager and get guidance, right? And then put together your proposal using the template I had just briefly showed you. Work with the headings that are in that template, and you submit it to this email account. We may change this mail, but no problems. You get the presentation. Even if it's changed, you get the right link that you would submit your proposal to. Okay, and there's a way you submit the proposal. It is also included in the template. So let me not bore you with all of that. Now, after submitting your proposal, you get approval for it. It will come to me. It will go to your programs manager. We'll look at it. We can say, okay, modify this, tweak this. Have you considered this and all of that? And then we'll say, go on, go ahead, and we'll give you whatever support you need. So as that is even going on, you should be stepping out of the building. Some people will sit down in their house and be making phone calls. Go outside, talk to people, knock on doors. All right, because you see, this is, will I say, borrowed knowledge or understanding from my other from the other thing I am, which is a product manager. If you're just sitting in your house waiting for your collaborators, your partners to come to you, then you are not ready. So step out of your comfort zone. I've not done this before. It's not an excuse. There's always a first time. If your legs are shaking, hold on to somebody that has done it before. Let them put you through and execute the project. So remember that if you ask questions, you will not lose your way. My DM is open. The DM of my assistant programs director, Emmanuel, is also open. The DM of Dr. Gambi is open. The, we are here for you, right? If you have a project to,
This I don't know if you're the only one that is here.
you don't really have to reach it on that not to summary, even if you are quote unquote lost or you don't know what to do yet. start asking questions, reaching out.
Dr. Praise, sorry,
Now, another thing is to browse the
sorry
project.
to cut you short.
Yes,
I think
please.
we lost you at some point and your screen something else showing.
Okay.
Like the
Was it
last
on this slide or the previous one?
let me see, the last 1 minute. I can't actually see anything on the screen. Let me just one again. And
Oh,
maybe try
really?
resharing.
Maybe. All right, I'll do that. Thank you for that. Okay. Are you seeing my screen now?
I am not. Can any other person?
No, okay, it is up now.
No, that's right.
All right. All right, that's fine. So this is where you lost me. Sorry about that. So I was saying that for those who have not carried out projects before and they don't know what to do next, you can rub minds, ask questions, reach out to this other person that you saw on the group chat had done this. Maybe we featured one other network member who did this project in China or in Rwanda. I don't know. You can reach out to the person and and politely request for guidance, especially for people who carry out projects within your region, because now they have, will I say, particular knowledge about they have particular knowledge about the intricacies of that region. So it will be good that you reach out to such people. You can also reach out to me or to any other person, any members of the programs team, all right, on guidance on how do I go about this. Then funding, we have opportunities you can look into. Individual donors, you see why you need to leave your house and step out, because you need to go enter offices, make phone calls, send emails, make requests. Sometimes crowdfunding, right? So these are some opportunities for funding. If you have more ideas too, you can also share with us, all right, other ideas that have worked for you in the past. So subsequently, as we get grants in the organization, as YOHAN as a whole, we'll be able to support particular projects. But for now, if you have a project you want to execute, you would have to also source for the funding for it. So partnership is so important, because you may not have the financial capacity, but if you are able to put together, this your proposal, and you can share it to, for example, a corporate organization who has a CSO, that's corporate social, CSR, corporate social responsibility, in line with that your project, they can sponsor you, of course. So these are things to look into, all right? And then even when we get grants and I'll be supporting individual projects, there's a criteria still. You have to be an active member. And active means that 75% of our programs within the year you attended, training summits and all of that. All right. So let's go on. I I don't know who among us here. This is January 31st. All of us now, we're all in the crowd right now. By November, December, 1, 2, 3, 4, 5, 6, 7, 8, I don't know, 100 people, 10 people, 3 people will have differentiated themselves. They would have made their names stand out at the end of this year, that wow, this person did this project and this was the impact they had. All right. So I'm not sure who that's going to be. It's up to you to decide if it's going to be you or somebody else. So very importantly also, when you're carrying out projects, the branding is important. So we have shirts, caps, the banners, ID cards. They'll have to have the official YOHAN logo. Now we have a brand management team. So anytime you have a project, no matter the continent, the country where you are, this can be forwarded and printed can be done wherever you are. All right. So because in the pictures, it needs to capture the fact that this is YOHAN. You are part of YOHAN. The project you did is part of YOHAN. So that's an example. Goodness me. So after execution, I have carried out a project. I have we administered surveys. We did the vaccination, subsidized vaccination. We did cervical cancer screening. We did mammography. Whatever it is that you did. After execution, you have to report. This is what I set out to achieve, and this is what I finally achieved. We have a template also for the report because my time has gone. I will not be sharing that. But in the folder link you're going to get, all of these resources are there. Okay, after execution, you have to report within 10 days. Within 10 days. I mean, it also makes sense because the shorter the time you take to do all your reporting, the more accurate it is, and will not be leaving anything out of the picture. All right. So how will you now go about all the submissions? You send them directly to the Gmail. The Gmail, you send it as an email, okay, and it will be received. So the assistant director of programs, Emmanuel, he will now upload this your project in an official folder and send you the link. So that link is what you will upload on your membership portal, what Dr. Ogamba talked about. Okay, so that link that the assistant director of programs gives you is what you will upload. All right. Um, and then, as I said before, if you have any confusion, you don't know what to do next, please don't know her. That's my WhatsApp number there. That's the official mail. You can always send me an email. You can always send me a message on WhatsApp. Some people are already doing that, which is good. I appreciate it, and they're getting the guidance that they need. The assistant programs director to Emmanuel, that's his WhatsApp number. All right, and you can do that. So I think we are clear on this slide. Why is project execution emphasized? Every network member has to carry out at least one project. You can carry out 100 though, as long as your academics do not suffer. Amen. Your what's the other one? Your professional life does not suffer. But at least one project. Okay, at least one project. And the next point on the slide, I don't know if you've heard of the proactive hepatitis project we did last year. It was done across Nigeria in 5 different states. Okay, so that's something else. Collaboration is so important. If Even if you want to collaborate with your peers or some other people on a larger project that's like quote unquote beyond you, all right, all of you can come together and have that umbrella of that, for that project. Yet and still, when you report the project, it will still count for you, even though it was part of a larger project. Okay, so for example, those in Kenya, in Cameroon, in Ghana, you say we have maybe a countrywide campaign in different states or different regions. Now all those projects together will be counted as quote unquote one project. Do you understand? But the individual projects in the different regions will still be counted towards those who collaborated, who managed the project. So that is why we emphasize project execution. So these are links. As I said, the folder for the guides and the templates, they're all here. And that's the YouTube link uh, if you're not on YouTube or if you've not subscribed to our YouTube channel. So what else is there? We have network member development. The fact that you're part of YOHAN doesn't mean you're just here to do. You're also here to receive. Okay, you're not just here to give only, you're also here to receive. And we have a lot of learnings, improvements, skill sessions that will be coming up over the course of the year and beyond. So, for example, I just put some topics here, but there are more. Systemic thinking, influence with authority. We talk about sustainability, how to factor in sustainability in your project, managing teams for innovation. All of these things are skills you can transfer to your own Ministry of Health. You can transfer them to your own your company. You can transfer these skills to your startup, your own NGO, whatever it is. So it will be your own best interest as a network member to participate in the programs, the trainings, and the resources that will be provided. And I'll soon be done. We're also working on providing health insurance for all our members. Once that is put together, we will all be updated. And Dr. Gamba talked about having an online course platform where you can go and learn about particular topics. So for those who, you may wonder what to do next, at some point we're going to come up with a project ideas bank. So you can just look through. Do you understand? So it just helps your mind work. And you can look at your own particular context, and then you know what to carry out in your own particular community or target audience. So these are materials you should be going through as a fresh network member: the brochure, the membership handbook, and then the folder. All right. So I don't know, do we have any questions? Do we have any questions?
I don't know.
Do we have any
I think
questions?
Kingsley could have made his presentation so that we can take all the questions together.
Okay,
I've
then
seen some
that's fine.
questions in the chat already, so we'll get
All right,
answers.
no problems.
So,
That's
so
fine.
and I also want to say
Thank you
that
so much.
beyond Kingsley, are you ready? I also want to say that beyond this meeting, we're going to be having a lot of communications back and forth. Dr. Priest had mentioned that moving forward, we will have the HR manager also give us important information regarding each team member. So let's say that the question is specifically, because I've seen a question, someone is asking about the branding. So let's say that your question is concerning our branding, how you actually can get that done. You have access to the media and brand manager. So we are all going to be working together as a team. So it's not like you're going to be left to just do your thing. No, that's why you can see that quality in the process. So you work with a specified proposal, you work with a specified reporting templates, everything is organized. Kingsley, are you ready? Are we still on for your session? We are time is fast spent. Okay, Dr. Price, please make Kingsley a host.
I have done that. Thank you so much for having me.
So Kingsley, I think 5 minutes is enough now. So that we will not keep. I know that we promised an hour 30 minutes, and it's like we have just 5 minutes, and we still have to take questions. So just like I said, the platform is going to be open. We're brainstorming on how to ensure that you stay connected with one another. And just a brief answer to a question someone asked. We asked about collaborating with members in his country. Some of the countries we have country directors, like here in Nigeria, in Tanzania, in Cameroon. We had in Ghana, but we're still trying to work that out to get back the country director for Ghana. So some of those countries that have country directors, it's going to be much easier for you. But those that don't have country directors, when it's time, just reach out to me or the programs team, and we'll see how to help out and get you the necessary resources and link you to the necessary people. All right, can you go ahead, please? Please make it a full screen, please. All right, thank you. Yes, you're audible.
Yeah.
You can see your screen. Sorry to interrupt. Can you hear me? Hello. Sorry, Kingsley, can you hear me? Hello, Kingsley, can you hear me? Hello? Kingsley? Hello, Kingsley, can you hear me?
I think it's
Hello,
next.
Kingsley? Yeah, please mute those people. I don't know why we keep begging, but they keep on muting themselves. I don't know, just mute them before you continue because it's interfering. And then please have to round up. At some point, you can do that. Don't wait for them to do that. Just mute them. So, and then I think some people on YouTube were talking about the volume. So I don't know if you can up that a little. Can you hear me? I said, please mute those people that are unmuted. And then, no, everybody's not muted. Just scroll up. Shamaki, Grace, a number of them are not muted. So please mute them. Yeah, please. Thank you. Yes, you've done that. Yeah. The YouTube people are saying the volume is low, so we might have to. I don't know. Did you hear that? Yeah, they said the volume is low. So continue, please. Yeah. We'll continue. Let's round up because I mean we've actually overshot. Full screen, please. Very much. It's surely going to be an awesome program here, like you rightly stated. I actually want us to round up this program as soon as possible. Some people have left. I hope they know that the attendance was just shared. So if you're on YouTube, the link was also shared on the chat. So please make sure someone is asking how to get their membership ID. I don't think the person has been with us since the onset. So I said you log into your portal and you're going to see a code that starts with YHN. Just copy it. That's your membership ID and ensure that it's part of what you're filling in your attendance because that's actually how we track your participation. All right. Thank you very much, everybody, for your those of you that have stayed to the end. I know some people, due to certain constraints, were not able to stay to the end. Some professionals, hospital working, some are students, and for one reason or another, and they didn't meet up to stay with it to the end. So I'm going to allow us to ask a few questions. The thing is, there will be a lot of explanations. Okay, we said we're going to be sharing. So I don't want you to feel like we're just going to abandon you after this meeting. All right. After this meeting, we'll make sure that all principal members, including state coordinators, that's regional state coordinators, including country directors, are going to be admins on our WhatsApp page at least. Now, the importance of that WhatsApp page is not for us. We're going to set some ground rules on the WhatsApp page. And one of it, like I mentioned the other day, is don't call anybody without first reaching out to them and establishing a rapport. We actually got a report on that, and it's not a good thing. Kingsley, you can make me a host again so I can mute people, okay? Just make me a host. So we'll round up in the next 2 minutes. So please, if you have any question, type it in the chat. Any question you think must be answered now, or any other thing that can wait, don't worry, we're going to answer all the questions. We're going to provide all the resources. I don't want us to unmute to ask the question because it feels like this is what I'm talking about. Kingsley, please make me a host, please. Kingsley. Hello, Kingsley. Okay, yeah. So, um, yeah, I can see it now. No, thank you. So please, let's try and maintain decorum, both on the WhatsApp group and when we're in meetings like this. It's very important. We're not the only ones that are in meetings like this. So being in a meeting like this and allowing yourself to distract others is not a good thing. And I'm sorry for the not so smooth session, especially at the beginning. And we keep trying to improve these things. And please, on the WhatsApp group, some ground rules which I will still type there is please do not call anybody without first reaching out to them and establishing a rapport. And please, that is wrong. Then number two, please don't just leave the WhatsApp group. If for any reason you want to leave the WhatsApp group, please inform an admin because we know that it discourages people. I mean, we're all in the WhatsApp group and then just wake up and leave. Please, if you want to read the WhatsApp group, tell us, right? We want to make sure that we give you all the necessary support. I mean, imagine that all of us that are registered members make our contributions, based on all we've learned today, based on what we've heard. We begin to think, we begin to look at how we can solve problems. I mean, it's beyond just doing small outreaches. It's beyond just going to do a health talk or hosting a social media campaign. You can take it beyond that. You can host big advocacy programs. I mean, it is possible. And imagine if you top member across the African continent here is making their contributions in their communities. Just imagine how much difference we can make. Okay, so that's the whole essence. Okay, we want to amplify the impact we can make. We want to accelerate the whole process of improving health outcomes in the continent. So I'm still waiting for questions. I don't know if maybe I can see the questions. Are there questions already on the chat box? If there are none, we will end the meeting and then we'll continue taking questions. Okay, Joy. Okay, Dr. Joy, let's start with you, please.
All right. Thank you very much for these sessions. A lot of information, but I'm glad to be part of this. So my question, I just wanted to be clear. So I understand that there are in-house projects and initiatives. Are these separate from individual or independent projects individuals will want to carry on along? Or let's say I want to do something aside what's happening in YOHA, so are these collaboratives or they can be totally independent of what's going on in-house?
Yes, thank you very much for that question. Yes, as an organization, we have our own programs. All right, and Joy, I think we're going to be welcoming you as one of the managers. So, well, I know you're new to this, so of course you need all the explanations. So, yes, we have our own programs that is a long-term thing, like I've already said. Okay. I mean, when I define programs and projects, I said these programs, some of them have a 5-year, 10-year lifespan. Basically, that's what it is. And then we do, even as an organization, we also have our projects that we organize. That the program managers organize projects, in different locations towards achieving the overall program objectives for specific programs. All right. But now we want to amplify impact, the impact we're making. We want to involve as many young people as possible in the whole process. And it's not something that maybe the programs team or a particular program just keep doing. And I mean, so for example, if someone, the program manager gave an example when she spoke, and she said, as much as possible, you can try for your projects, individual projects to align with a specific program in YOHAN. All right. Let's say it's something that is related to hypertension in rural communities. I mean, that's linked to Science Project. All right. So that in that way, the person, that individual, as a member of YOHAN Africa, is carrying out the project, but it's actually more like in partnership or linked to the program team of Science Project. All right. So it's like we want everybody to be involved. That's the point, right? Everyone has to do something, and it might not entirely be what is covered under our current programs, okay? But I mean, we encourage it to be a starting point because we already have resources to support people that want to do projects in that direction, okay? So yes, every member is expected to do their projects, but that doesn't stop us as as the One Africa team to continue working on our program, because we have a program objective, we have targets for the programs that we want to achieve for the year, for the next 2 years, for the next 5 years. So whatever the members are doing is like, supporting and ensuring that we achieve our aims, and even going beyond that. All right. So it's different, but it's still connected. All right. Every member does a project, one project every year. And I don't want us to be so scared about when you hear that you're going to do a project. I know that a lot of people might be wondering, how am I going to pull that off? And that's why we've taken time to actually give details of how this is going to work in terms of the resources we have, the support we're going to give you. And I also want to mention that we're very particular about low cost interventions. Okay, so we don't want you to, of course, I know some ambitious people here might want to do the big stuff, but the point is that it mustn't be the very big stuff that needs like the big grants. Okay, you can actually start small. I was even giving the program manager an example. I say someone can do a TikTok series and talk about a specific issue, maybe gender-based violence. That qualifies as a project. All right, so long as it's sanctioned by the programs department. Okay, so the point here is that we want everyone to be involved. We want all hands on deck. It doesn't stop us as the YOHAN team. We already have a structure to continue doing what we're doing, and then guide as many people that are involved as possible. So it's already been mentioned. It's a criteria. You must do something. So that's there was another criteria we had for membership. We had to remove for inclusivity reasons. Okay, so we just decided to go with this single criteria, which is make sure you are active member and deliver a project, at least one project in the whole year. You can decide to host a mini conference, you can decide to host an advocacy campaign, whatever it is, but you have to do something. All right. Joy, does that answer your question, or you need more clarification?
Yes, it does. Thank you very much.
All right, thanks. All right, so Samuel's victory. Were you able to charge eventually? You can unmute and ask your question.
Hello and good day. Thank you for giving me the floor. Well, I'm still charging, but my battery is quite low. Thanks once again. So my question is about the research. When I got my congratulatory mail, I went through the website and I saw that there is an opportunity to be part of a research project. And I can call myself a researcher because I've been engaged in research and honing my research skills. So how do we get involved in this? Second, about the project, most of my questions have been answered during the sessions, but I still want to inquire. Is there a stipulated period when members are expected to conduct this project, or members can carry out the project any time of the year? And lastly, what's the organization's calendar like? Does it run from January to November or September to September? What's the organization's calendar like? Thank you.
Thank you very much. Thank you for that question. I really appreciate your dedication already. I mean, you said you're charging, you have to join still. So the first question is about the research, right? So yes, we have a research institute, like I mentioned, is a semi-autonomous institute, and it's just time. We have time constraint. I don't know. I would have called the director of the institute to also give us a brief, but we'll have time for all this. All right. Now this session is not supposed to last so long, so we just want to give you an overview, and then we'll continue the communications beyond here. When you're going to get a document that contains the information of the directors and their emails and phone numbers, WhatsApp numbers, you're also going to get that of the research institute director. And now you've shown us that you're interested in research, which is actually one of our strategies. I'm going to encourage you to actually reach out to the director and know what is going on. All right, they have plans for the year. We're already working on some projects, some research projects. We're trying to finish up some research. We're trying to write up some of the results from our previous projects. So all those things are currently going. So we need hands, and we also do training. At least once every year, we do a training, a research training, a full blown research training. So there will be one later in the year. We've not decided when it's going to be. All right. So yes, the Research Institute is is there to support you as a researcher, to help you hone your skills, to help you improve, and to contribute to the research output out there. So I'm not going to dwell much on the research. I'm not going to dwell much on, sorry, I'm trying to, okay. So I'm not going to dwell much. I'm trying to minimize this so I can see very well. It keeps going back. So yes, I'm not going to dwell a lot on that, but we do a lot of research. The other day I just posted something on my LinkedIn, and it was one of our abstracts that was accepted for the World Hepatitis Summit. And that abstract came from the results we have from our advocacy for the sexual health. So in every of our projects, we actually collect data. All right, we do a study. And I think this is a very important question, because we also encourage members, when you're doing your project, if you have an opportunity to get data that we can utilize for for a research, we encourage you to do that. And that's why you see that we have we have a very robust team. So if research is part of what you're doing in the project, the directorate of research is going to help you arrange that and make sure you have when you're doing something that is standardized. All right. So the point is that whatever you're doing that is connected to us, we have to be able to sanction it and make sure that you're doing it the right way and getting the right results. So about the calendar, the time frames and all, yes, starting today, we started counting. And for your project, we encourage you to do it between now, starting today, and November. And the reason is because throughout the year, we know that everybody might not be able to do a project in March, in April, based on your personal reasons. You might be a student, you have a final exam or something, sometime in the year. So that's why it's personal. Just choose a time it's very convenient for you and post your project. But we want it done before the second week of November, and the reason is because we want to be able to collect the data from everything that has been done, assess the progress that was made by individual members. And also, Dr. Praise refused to mention that so much when she spoke, but we are working on a membership project fund. We're working on a lot at the same time, and we're trying to make sure that you have the best as a member. So we're working on a membership fund. We're trying to see if we can raise some money beyond the grants that the grant manager mentioned, all right? But we're not making promises yet. Okay? It's still working. It's still a work in progress. And then we're also going to be awarding outstanding members during our town halls and the end of the year programs. All right. So there will also be the cash prizes. All right. We have to decide what's going to be, but we want to also recognize people that have done exceptional projects, that have performed exceptionally throughout the year. So we want to have these projects done. I know that for some people, we might make some exceptions. For example, we know that some people might want to do something on World AIDS Day, which is surely like 10th of December. So we can accommodate, those exceptions. All right, but we want it done, if possible, before the end of the second week of November. So there's ample time to plan, to conceptualize, to plan, and to execute. All right, and you have all the support you need to do that. So there will be a lot of questions answered. My DM is open. Some people have already entered my DM to ask questions, but I'm not able to answer everybody's questions. So what I'm going to do is to make sure that we have the link to all team members, so you can ask questions specifically to people that have the answer to your questions. Because if you start asking me about so much about grants now, and I don't know some secrets that the grants manager already have, so it would be best to just speak to the grants manager when it comes to grants issue. I don't know if I answered your question.
Yeah,
I don't know if I answered your question.
You did. Thank you.
Okay. All right. So if there is any other, like I said, we're also a growing organization. So we accept, your suggestions every single day. You have any suggestions, any better way we can link you guys up to make sure that there's this proper networking that goes on, so you can also collaborate on projects. Any way you think we can do better, please. Your feedback is welcome anytime, any day. Christian Emery, please. I hope I pronounced that right. Please ask your question.
Okay, so good evening, everyone. My name is Emery Christian from Ghana. So during the presentation, you made mention of local reps. So I would want to know that is it that we have local reps for every country, or they are selected by by the board members, or like how is it like? I want to know. Please, can you throw more light on the local reps for me? Thank you.
Thank you very much. I like that question because, I mean, first of all, I want to say something before I answer that question. Why we are using this approach is because we believe that every one of you is a leader. All right, you have what it takes to lead. All right, you don't necessarily need someone to, of course, with the support of like what you have, resources and all, or you have the full potential to be a leader. Right. So even without maybe having a country director, as you can see, we have some people coming from Morocco. We have a number of people from different countries, and at the end of the day, we don't have country directors in those places yet. But it doesn't mean that they cannot do their projects without the guidance we're going to give them. So yes, for last year we had okay, I will say the country director for Ghana, it was Scott Godfrey. Scott is on sabbatical. So we don't have a country director now for Ghana. But let's say that we are able to work out something and we want to have a regional director or coordinator or country director. What we don't want to do is just to have people sitting and answering maybe big names, and then there's actually no impact from an office. All right, so we don't just want office holders. So that's why we're not all about, oh, I'm the regional this, I'm the country this. No, we actually want you as an individual to have to actually express yourself, be able to do this stuff, and whether you have a country director or not. I mean, if you have a country director, good and fine. That person can help maybe put one and two together for you. So we will, but you can reach out to me directly, okay? Christian, you can reach out to me directly so we can discuss further. But we don't want to just have a situation where we have many country directors, state coordinators, and everything, and still, I mean, they're just office holders, all right? So we want you to actually be able to take charge, whether you have one or not. And the only important thing the only important factor when it comes to country directors is that they might be able to help you connect to certain people that might help, when you have maybe a project that goes beyond your state or your region, okay? But the country director is not the person to do your project for you, okay? So let's start let's talk more on that. And when we are ready to like expand, we're going to do that gradually. We already have our footprints in Ghana, so we can continue that. That's why I said, Jamie, let's continue the discussion. Please, before I answer the next question, I know some people have filled the forms and left. So before you leave, please ensure that you fill the attendance. It's very important. Adela Fatima, please ask a question. Kingsley, you also have a question.
Good evening, and thank you for the I hope you can hear me, please.
Sorry?
I said, can you hear me, please?
Yes, we can hear you. We can hear you. Go ahead.
Okay, so my question is, just as there is guidance and assistance for projects and proposal, is there also one research? Like, let's say I have a research idea and I need assistance for actually looking at it. I get that. Secondly,
we can't really hear you. You asked something about support for research, right? Research projects, right?
Yeah, support for research proposal, just like there is for project proposal.
Okay.
Is there like assistance? Like, let's say I have an idea of a research that I want to work on. Can I get like assistance from the institute? Second question.
Oh, okay. Let me answer Fatima's question first. So Fatima, that's a very beautiful question. And we actually had that discussion and we're like, okay, how about people that might want to do a research as their project? Now, the answer to that question is yes. And why is it yes? When you're doing a research, you're gathering evidence, right? You're trying to, of course, we mentioned this as one of our strategies, research, okay? And whatever evidence you have and you're reporting and you're showing to the world is making a difference. In fact, if you go to our Research Institute page, you see something about on the about page, which talks about our research output from Africa. I don't even want to mention the figure; it's too bad. So yes, okay, sorry. I didn't know that the institute director is still here. Dr. Promise, please go ahead. I think it's here. This question is your question. Go ahead.
Okay, good evening, everyone. I've been trying to respond to some questions as regards the institute. So I believe, yeah, it's okay.
I'm so
So,
sorry.
yeah, in
I'm so
response to
sorry.
your question, my dear, I just like my chief, Dr. Gamba, has spoken. Yes, it is very much admissible. The thing is that, there are points in time whereby people would want to conduct research as a project, and you find out that at the end of the day, it's either they are trying to bring in, they are trying to collaborate with you, or rather bring in your knowledge so that they can finish their final year project for those in school, which is not bad, anyways, but we see that the aim is defeated. Now, what we do is that when you have such a project, we run it through. I we always partner with a programs project manager, or project programs manager, and also with Dr. Praise, who always monitors and evaluates some of our work. I think I've done some of those things with her in the past, whereby I had to send her some questionnaires. So when you have such a project, you run it by us. We scrutinize it, we analyze it, we tell these are the limitations. This is where we can help. This is where maybe we improve more on. Okay, so if that, having said that, it goes a long way to show that we don't just accept projects or rather research proposals, and but we have to, put in dot the i's and cross the t's before we can admit any research proposal. Thank you.
Thank you very much.
Thank you
Sorry,
very much, sir.
I didn't know that the Oga himself was there and I was busy answering for him. So please, you see what I said? We have, the team is complete. So any question you have, any concerns, there is someone in the YOHAN Africa team to answer a question. If it's an issue of grants, if it's an issue of branding, if it's an issue of a program, we are complete. All right, we have a full program directory. So please answer the question from YouTube. Yes, go ahead, please.
Hello, good evening, everybody.
Okay.
My name is Ira. Can you hear me?
Yes, we can hear you. Go ahead.
Okay, my name is Ira Kosi. I would like to say thank you for this opportunity once again, and I'm really looking forward to working with the team. So my questions are, number one, I am based in Abuja here. I don't know if you have physical meetings, or aside the WhatsApp group, are there groups for program teams that can keep guiding us? Because I don't think one meeting is enough. I think we had a lot to absorb at once. So I don't know if there are ways we can keep guiding us, because I really don't understand most of the way that we can carry these projects out. Are we to join teams? Are we to develop projects by ourselves and submit them, and then with your guidance, carry out whatever it is I want to do till it's completed? So these are the clarifications I would like. I'm going to keep I'm going to look at the website and study it in details to get more information, but to be sincere, we need more guidance. Thank you. These are my questions.
Thank you very much, Kosi. Because I said something earlier. I said, I actually acknowledge that this first meeting, a lot of people have so many questions, and those questions might not be answered today. And this is because I need to follow you up. You answer questions, have you joined teams? So first of all, you asked about a physical team in Abuja. So far, we don't have physical meetings. It's not a bad idea if there is a group of members in Abuja that can meet. We're not against that for any reason. But you can appreciate the diversity here. You hear people introducing themselves from Malawi, from Tanzania, from Ghana. So we are able to like, and so far in YOHAN, I don't know, even as a team, we don't actually meet physically. That's the truth. I'm going to say it here now. And that is because, I mean, this is 2024. Okay, people work remotely now. People sit in their houses and deliver jobs. Companies in the US, in the UK, across the world. So everything is possible with proper communication, doing right. We might never have an opportunity to meet, but you could do a project that affects me as a member of YOHAN, doing something that also helps you do something for people where you are. So yes, we don't have physical meetings per se, but if that needs to happen, we can arrange for that. And then yes, there will be proper guidance. We are working on, for joining teams, we're going to need, for different teams need different kinds of support. So if you want to officially be a team member, Kingsley already said listed some positions that they need people to actively play part in. The research institute needs members. Communications manager has also asked that she needs something. So we're going to be having people join different teams. When it comes to getting the guidance, like we said, we're going to give you access to the people that have the resources, the answers to your questions. So let's say it's a programs team, you have access to the director of programs, the director of programs, the different program managers for our different programs. And we're also considering something, we've not decided on how we're going to do it yet. It depends on the feedback we get from you. And remember, this is our first official call members. So we're learning the process also, and that's why we want your feedback. As soon as you have it, just give it to us. All right. So we are considering also developing a board structure where we get to have members in just smaller units, okay, where we have each team lead also making sure that these people are carried along, getting answers they need as soon as they need them. But that's something that we are going to consider depending on the feedback we start getting from you, right? So after this meeting tomorrow, we're going to be getting resources shared both on the WhatsApp group and to your emails. And please, if you're not getting our emails, please make sure that you inform the communications manager, who you're also going to have a number in the list, so that you are in our mailing list, okay? Because we're going to be using our emails a lot. We're going to be communicating via emails. So just always look up our emails. Some things that are going to be sent on our emails will also be shared on the WhatsApp group. So that's the essence of that. So that apart from talking is possible, yeah. But apart from that, to ensure that we also share information and maybe we didn't see it on your email, so see it there. And the communications manager mentioned something about ensuring that add our email to your email list so that it doesn't keep going to the spam box. All right. So yes, we have plans to make sure that you're okay. There will be no confusion. I promise you. All right. So even if others are not responding to you very fast, you can chat me. I think you've been seeing my posts on the WhatsApp, so you should have you can chat me. Okay, ask your question. Right. So anytime you need guidance, maybe you have an idea, you feel like is it so out of place, is it get answers. The program manager mentioned something about the project ideas bank. So make sure that make sure it's not you have access to. Because it's just something that can give you an idea of what you can. I'm giving examples of some of them. All right. So there will be guidance, okay, every step of the way. So don't worry about it. Okay. Just make sure you stay tuned. WhatsApp, check the emails that we're going to be sending out to help guide you every step. Right? And considering that every member does not have the same timeline in terms of what they want to do, that's why we want that kind of one, because we'll be doing trainings and maybe sessions later. We also have our summit coming to expect them to participate. But we also understand that members have different timetables. Okay, someone might be planning this project in October, you're planning your own in March. All right, so the person planning in October might not be in a haste, but of course, you that is doing in March, you need also to get help with certain classes you might need. So of course, it's different. We have to pay attention to you because you're doing in March. So that's also that's why we want to personalize it, right? I hope I answered your question very well. time is so fast spent. And I know that those people who are still on this call would actually want to hear the answers to this question. So Kingsley, ask the question from you too.